just going to take a little look at your charts real quick, if you don't mind. There we are. Quite a lot of information here. Okay. Good. And let me just note down a couple things. So, heart rate looks good. It's about 70 beats per minute there. Blood pressure, 120/80 millimeters mercury. Excellent. So, your vitals have been pretty great throughout your stay here. So, I'm here to do a full body examination. We're going to start at your head and continue down along the face, neck, chest, all the way to your toes. So let me just put this down. There we are. And if you don't mind, I'd love to just start by taking a look at your head and your scalp. Okay? So let me grab a little lighted tool here, and I'm going to just take a little peek around here. Good. Let me know if any of this is painful or uncomfortable. There we are. Good. And we're just making sure that everything looks normal. I don't expect that anything will be abnormal, but while you're here, we might as well make sure. Okay, so that's looking pretty good there. Just going to look right along the hairline here, so right by the ear, and then right here around the other ear. This light is quite helpful because it's got just enough light to illuminate without bleaching anything out. Got this little point of warm light and this spectrum of cool light. I can have different color temperatures to look around. Good. Okay. So I'm just going to palpate around your head. Again, let me know if anything is uncomfortable here. Good. Just feeling the contours of the skull. Making sure that everything is the right shape. Okay. And let me just grab my tool here. I'm just going to check some symmetry here. Don't mind the shakiness. It's just a benign tremor. So, making sure that everything is reasonably symmetrical. And things are midline. Good. And then, the eyes, the nose, the ears run right about there. Okay, excellent. Feel around here. Over here. Okay. let's take a little look at your skin while we're here. I'm going to bring out a brighter source of light. I'm just going to put it underneath the skin here, underneath the face. See the skin. And maybe we bring this right in here. I just don't need the full force of this. Just need a little bit of directional light. There we are. Okay. Looking at any abnormal spots or lesions. Looking at texture, erythema, hyperpigmentation. Okay. Good. Do you have any spots here that you have any concerns about on your skin? Okay. Very good. Well, let's go ahead and take a look at your eyes then. So I'm going to keep this light right about here. And we're going to look at the sclerae, the pupils and irises, the eyelashes, eyebrows, and let me know if this is painful at all as I palpate around the orbit. Okay, good. And let's go ahead and just get a closer look at those pupils of yours. So in a moment, I'm going to test your pupillary response. Right now, I just want to get a little baseline. Make sure they're the correct shape. That they're of equal size. So if I could have you just look at the wall right back there. That'll help reset your eyes. Okay, and can you just look at my nose? There we are. Good. I'm going to be bringing the light in at different distances. It might be a bit overwhelming. Just looking at how your eyes react. Good. Just keep looking right here. Excellent. Good. Yep, that one's a bit bright. Good. And like that. Okay. Wonderful. So, let me grab my tongue depressor here. I'm going to have you just follow the tip here of this tongue depressor as I move it around so we can test your eye's ability to move in different directions. So, let's focus right here. Okay? And just follow the little tongue depressor around. It's a little hard to do that with my non-dominant hand. There we are. Different distances, different directions. About down here. Good. Start a bit random and then maybe get a little more structured. Good. Just keep following the object. Excellent. Now, this is where we'll do this a little bit more structured, just to double check. So can you move your eyes this way? Up, down. And how about the other side over here? Up, down, back to the middle. Let's go up, down, up, down. Okay, so no signs of lid lag there. And how about if we bring this diagonally up and diagonally up, diagonally down, and diagonally down. Good. Can you look at the wall behind us again? Just resetting your eyes. We're going to test your accommodation reflex, which allows your eyes to focus on things that are close up and far away, different distances. Go ahead and focus right here. Okay, keep focusing as I bring this out. Good, and in, and out, and in. There we are. Go ahead and look at the wall. Very good, and right here. Out, out, in, and out. Okay. You can blink if you need to. You're doing quite a few things there. And let me grab the light again. I'm going to test your peripheral vision. And I'm going to do this by bringing the light in. And as soon as you see the light, you can say yes. So if I were to do it right here, you would say yes as soon as you see it. Go ahead and focus right here. Okay, keep your eyes trained right there. Let me know when you see the light. Good. 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 Yes. Excellent. Very good. There we go. Very good. That was perfect. So we are going to need this little guy for our next part. We're going to take a little look at your ears. But the first thing I want to do is have a look at the outsides. So I'm just going to look around here. Good. And behind the ear. Okay, let's go ahead and look at this side. Okay, back here. Okay, good. All right. I'm just going to have a little look with the otoscope. The light for a moment. Your bed's a bit creaky and cracky, huh? So let's go ahead and just take a little look inside here. Let's see. I see that on your charts there hasn't been anything in particular going on with the ears. But again, while we're here, we just want to check. Have you had any issues with your hearing at all? Okay, any pain or tenderness or itching? Okay, so no issues with the ears at all. Okay, that's great to hear. Alright, so I'm going to have you lean forward for me so that I can reach you and see inside of your other ear. Okay? Right. I'm going to lean on the bed a bit. You might hear that crack or creak. And I'm just going to right over here. So let's position otoscope first. There we are. So luckily I just need to be able to see in that little screen. And looks like, okay, so there aren't any signs of irritation or blockage. Tympanic membrane looks great. Good color. No perforation. And all the tissues, good color. I'm quite pleased with that. There we are. So I've got a couple of tests to do with you, and they involve a tuning fork. This is a 512 hertz tuning fork. I have this little striker here that we use to hit the tuning fork, or we can do it like this. So I'm going to be taking the tuning fork and putting it right here, and I'm just going to have you tell me whether you hear it more on one side, the other, or right in the middle. One side, the other. Okay, good. This time I'm going to put it behind your ear, and you just tell me when the sound stops. And then I'll put it in front of your ear, and then again, tell me when you hear the sound stop. When does it stop? When does it stop? Good. Stop. Good. And it stops. And stops. Good. it stops. And it stops. Okay, very good. Now I'm just going to have you tell me whether you hear the sound of the tuning fork on the left side or the right side. Mm-hmm. Yep. Okay, so hearing is all good there. So let's take a little peek at the nose, mouth, and throat areas. Take that bad boy off. And just look, if I could have you tip your head up. Good. Looking inside the nose. There we are. Good. Okay. And if you could open your mouth. Just take a little peek at the teeth and the tongue and the oral mucosa. If I could have you just lift your tongue to the roof of your mouth. Good. And if you could stick out your tongue as far as it'll go. Good. We're just going to look at the throat. Could I have you say ah for me? Okay. So, cranial nerves 9 and 10. All good there. And smooth. Well, pharynx there. Okay, that all looks good. Go ahead and close your mouth. Let's take a peek at your lymph nodes. So you have some lymph nodes at the back of the head, some behind the ears, in front of the ears, under the jaw, along the neck, and above the clavicle. We're going to start right at the back of the head here. And then come behind the ears. In front of the ears. Underneath the jaw. And along the neck here. And at the collarbone here, the clavicles. Supraclavicular. Okay, now let's get out the stethoscope. And we are going to listen to the carotid artery. Make sure there aren't any heart murmurs there. So I'm going to put the diaphragm of the stethoscope on the carotid artery. I'm going to have you take a deep breath in and just hold it for a few moments, okay? All right, so deep breath in. Just keep holding. And out. Deep breath in. Hold. And out. So I'm going to keep using this in a moment, so I'll just keep it on, but I'm just going to have you take a dry swallow, and I'm going to feel around where the thyroid is. If I could just have you swallow here. Good, and then I'm going to just palpate the carotid artery here, just to assess the strength quality. Right here. Good. So, in terms of the heart here, heart and lungs, I'm actually going to just pop that out for a second. And we're going to look at the chest wall here. So, here I can use the heel of my hand or the flats of my fingers to palpate for heaves or thrills. So I'm just going to put my hand on the chest in different areas. And we're going to see if we have any of those heaves. The heel of my hand. And thrills with the flats of my fingers. Good. Okay, good. So now I would just like to percuss the lungs. So we'll start at the lung apices here at the top and work our way down. And I'm just going to use my fingers to tap along the chest here. So we'll start right here. And here. Move down. I'm just doing one set and then a second set to double check. Good. We'll bring out the stethoscope again. So, let's start with the lungs. I'm going to have you take a deep breath in and out. Deep breath in and out. Deep breath in and out. Deep breath in Deep breath in and out. 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 Okay. Let's see here. I'm just going to have you breathe normally as I listen to the heart. Good. Okay, right in here. Okay, let's find the apex beat real quick. So we have the clavicle here, and we have 1, 2, 3, 5 intercostal spaces. So that's right here. Okay, good. So we're going to listen to the abdomen first, and just keep breathing normally. Good. Very good. And I'm going to do some percussion along the abdomen here. Oh, that must have been a button. Yeah, right there. And we're going to do some palpation here. So let me know if any of this is painful or uncomfortable. Let's take a look at your arms and legs. So I would like to test the reflexes first. I have here a Degerin or Degerine, either way, reflex hammer, quite a unit here, and I am just going to grab your biceps and triceps reflexes real quick. So if I could have you poke your arm out of the sheet. There we go. And if you could just relax the arm here, and I'm going to knead the back of the elbow as well as the inside of the elbow here. Okay? So if I could just have you keep that arm relaxed. Okay? And then if I could scoop that arm up here. Good. The other side, if you could poke that out. Alright, back of the arm here. And inside the arm. Good. And then our patellar reflex. So we're going to position you just like this. Then I can get the patellar reflex here. Okay, right here. Good. And the other side here. Good, so let's go ahead and just readjust everything and put this down. So let's take a look at the arms and legs here. So, temperature is warm but not hot, no clamminess or sweatiness. Let's check capillary refill. Okay, and just look at the skin. Good, and can I see the palms of your hands? Good. Okay, so no erythema there, no hardening. There are no contractures. Looks great. So the legs here and the feet. We didn't have any abnormalities with temperature or the skin or capillary refill as well. So I'm going to just come up a bit closer. There we are. And I'm going to have you do some range of movement stuff for me. Just a couple of things. So I'm going to have you move your wrists up and down. Good. Inside and out. Roll internally, externally. Good. Can you move your elbows up and down? And can you bring your arms all the way up? As far back as you can. And up from the sides. Good. And can I have you kick out at the knee? Good. And at the ankles, bring the feet up and down. In and out. And roll internally, externally. Okay, very good. So let's go ahead and let's just put this down in your file. So we did our head and face exam there. Looked at your eyes, cranial nerves 3, 4, and 6. were intact. Checked your peripheral vision there. Weber-Renée test. Vestibulocochlear nerve is intact. Glossopharyngeal and vagus nerves are good. Lymph nodes, carotid and thyroid, heart, lung, abdomen, and extremities. Okay. Okay, let me just sign my name here. And we'll just put that back. Okay. Do you have any questions for me? Yes, I'm not sure when you're able to get out. I will pass that along to the doctor. See who is overseeing your care. Okay. Alrighty, yes, Dr. Sloan Sherrill. So I will pass that along to them, and they can come visit with you and chat a little bit about when you can be discharged, okay? Alright, so any other questions? Alright, well, let me just straighten out the sheets here. There you go. And thank you so much for allowing me to conduct your examination. I really appreciate it. I hope you have a whale of a day and a good rest of your night. Thank you.